Good afternoon, Mr. Chairman, Ranking Member Davis, and other distinguished members of the committee. Thank you for the opportunity to testify about the Office of Inspector General's recent audit report involving Medicaid payments in New York. Medicaid payment rates for state-operated developmental centers in New York are extremely high. In state fiscal year 2009, New York claimed more than $2.2 billion in Medicaid reimbursement for these centers. The actual cost of operating the developmental centers was $578 million. The $2.2 billion equaled over $4,100 per day for each of the 1,700 beneficiaries and resulted in New York receiving federal matching funds of over $1.1 billion. So why are these Medicaid payment rates so high? Chiefly because there is no requirement that Medicaid payments be limited to the actual cost of providing services. When the current rate-setting methodology began in 1985, New York's daily payment rate for the developmental centers was $195 per beneficiary. By 2009, the rate had grown to over $4,100 per day. $4,100 far exceeds the daily payment rate for all other similar public and private facilities in New York, which provided similar services for a fraction of the cost of Medicaid. Unlike the developmental centers, the payment rates for these other facilities were based on cost and ranged from $257 to $902 per day. If New York had used actual cost as part of its rate-setting methodology for the developmental centers, total Medicaid reimbursements could have been at least $1.4 billion less in 2009. This could have lowered federal Medicaid payments by at least $700 million for that year alone. For over a decade, OIG has recommended that payments to public providers be limited to the actual cost of providing services. This would help ensure that in New York and other states, Medicaid payment methodologies for public providers are reasonable and economical. Until such time as payments to public providers are limited to actual cost, CMS should work with New York to ensure an appropriate Medicaid daily rate for state-operated developmental centers. Thank you for your interest in this important issue, and I would be happy to answer your questions.